Hi there, my name is Lindsay Roberts, and I am presenting today on Graves' disease. Now, Graves' disease is an autoimmune condition that is systematic in nature. It affects a lot of different organ systems, a lot of different systems that function in the human body. This condition causes hypersecretion of thyroid hormone, and that has an impact on a lot of different functions. The thyroid hormone itself is responsible for controlling growth, metabolism, it balances out hormones, and controls things like heart rate and temperature regulation. So when your thyroid is oversecreting, your body is really outside of this homeostatic state it wants to be in. Now, this condition occurs when your immune system is attacking your thyroid gland. And it does so by creating an antibody called thyrotropin receptor antibody. Now, this antibody essentially takes over your pituitary gland, which is responsible for controlling your thyroid gland and its hormone secretion. When this antibody takes over, the thyroid responds by oversecreting thyroid hormone, and this is what leads to a lot of those systemic symptoms that people encounter. When someone basically is diagnosed with Graves' disease, it is due to about 80% inheritance, 20% environmental factors. When we consider some of the symptoms of Graves' disease that patients present with, the one you hear about most commonly is called exophthalmos. With this symptom, there is actual swelling behind the eyeballs. This causes them to bulge. And this essentially gives patients this facial expression of having very wide eyes. Other ocular symptoms are a gritty sensation, some ocular pressure, inflammation, photophobia, which is light sensitivity, diplopia, which is double vision, and even vision loss. Now, other symptoms that patients encounter are just a general fatigue, some difficulty moderating temperature, body temperature, so some heat intolerance, tachycardia or a fast heart rate, impotence, sexual dysfunction, weight loss, some gastrointestinal symptoms like irregular bowel movements, and an interesting one I wasn't aware of called Graves' dermopathy that occurs on the feet and the shins and results in a thick, discolored layer of skin in that area of the body. When we think about treatment for Graves' disease, there are some diagnostic tools in the toolbox that endocrinologists use. One being RAIU, in which how the thyroid takes up iodine is measured, Doppler ultrasound, and then there's some blood tests and antibody tests to determine if the immune system is creating this antibody that fights or attacks the thyroid. Now, an endocrinologist may prescribe something like a beta blocker to treat the cardiovascular symptoms, such as tachycardia. Antithyroid meds can help regulate hormone production, prevent that oversecretion. Radioiodine therapy does destroy the cells in the thyroid gland, but reduces the hormone secretion. And most invasively, an otolaryngologist can perform a thyroidectomy, which is a total excision of the thyroid gland to prevent some of these symptoms from occurring. Thank you for listening.